easy it is. Just give us a call, 593-7181, and Dr. Dunbar will answer your questions. Now, you said you have exercises.
Yes. So what you want to do is strengthen up your ankles. These exercises are common in people that have frequent ankle sprains or are recovering from an ankle sprain. I'm going to attempt to do them with my model, okay? So the first one is have your foot planted on the floor and you just move your foot in. And then you hold it there for a period of time, let's say 20 seconds or so, and then make your foot go outward. And then hold it for, you know, once again, 15, 20
now what does
seconds.
that accomplish?
It's strengthening the ligaments that are on the sides of the ankle.
Okay.
Okay. The next one that you can do is you want to hold on to a table and you rock back onto your heel, but make sure you're holding on to something. Once again, hold it for 15 or 20 seconds, then rock forward and go onto the ball of your foot, hold it, and then go back again. And you want to repeat it several times. Strengthening your Achilles tendon, which is on the back of the leg, is also very important. There's lots of ways to stretch the Achilles tendon. You can do it against the wall. You can do it sitting. In a sitting position or laying position, you have your legs straight, and you use some kind of strap or belt or something to pull your foot forward. And then once you pull it forward, you'll feel a little stretch in the back of your calf muscle, and then once again you hold it. And all of those, you want to repeat them several times as you're doing it before you move on to the next exercise.
Interesting. You know, I've slipped out there today. I mean, it's really easy to slip on this in this kind of weather. I've had a condition with problems sometimes, like the ball of the foot underneath here. I'll get like a spasm in there, like it's like your foot's doing one of those claw things. Is there anything? I mean, anything to make that? I mean, is there something that causes that, or is it just a spasm from?
Yeah, spasms and cramps in the toes are very difficult to deal with. In those cases, it's more of abnormal pull when you're walking. So stretching is helpful. Some people require inserts for their shoes. It's a little different than when you get a cramp in your leg. Usually, you know, a cramp in your leg, there may be a reason for it. You know, your electrolytes, potassium, magnesium, and stuff might be off. But, you know, in those conditions can be treated. Drinking Gatorade and things like that might be helpful. When it's in the toes, it's abnormal walking most likely, and you kind of just have to let it run its course. I mean, you can, you know, try to stretch it out and whatnot, and it can be pretty painful.
So with some of those exercises also, I have what they call weak ankles. When I played baseball and stuff as a kid, I mean, I don't know if that caused it or what, but is that... Would exercises
Those would definitely be helpful.
Would they?
Yeah. People that have had frequent sprains from participating in sports, I always thought a sprain was not a sufficient word to explain what's actually happening. It sounds like it's, you know, not that significant. When someone sprains their ankle, they've actually ripped the ligaments away from the bone.
Really?
The ligaments are very small, so we don't go in and repair them. And that's why, you know, a sufficient amount of, you know, ice, elevation, trying to stay off of it, they are in pretty much proximity that they'll grow back. But when they grow back, often it's longer than they were. So now your next sprain, it's easier for you to get. And then over time, you know, it can become a problem.
We had, of course, Chuck and I are football fans, and we've had 3 quarterbacks in Cleveland with high ankle sprains, and they were using walking boots to walk, and apparently that's because of the ligament damage, apparently. And now that you explained that, I can see why when the one guy went in, one of the quarterbacks went in, why he damaged more of his ligaments. They put him in too soon. Can you explain a high ankle sprain?
You know, I'm not 100% certain what they would be referring to. The ligaments that are most common to rip during an ankle sprain are on the outside, actually it'd be this side, the outside of the ankle. That's the most common.
Okay.
On the inside, it's called your deltoid ligament. It's a whole bunch of ligaments together and more difficult, but we also see that. I would assume, and I'm not certain, that the higher sprain would be what's connecting your tibia and fibula together. And, you know, that would be one that's more difficult to treat. Just as I've showed you exercises strengthen these down here where your leg is connected to your foot, you know, there isn't a stretch to do in between these two bones to strengthen that. I would assume it would be, you know, rest, you know, the ankle boots and stuff. And the strengthening probably would still be geared towards strengthening the ligaments down here.
Many years ago, Doc, I twisted my foot and broke the bones on the top of the foot in here. Painful as heck.
Yeah.
I was in a cast for like 8 weeks.
I was going to say, it takes a long time to recover from that, too. Actually, it's kind of difficult to do. What were you doing?
Actually, I was
just walking.
I was standing. I had a bad habit years ago of standing with my ankles, like, you know, like standing on my ankles. Basically, was stupid, and a guy just kind of pushed me, and I twisted enough where I lost my balance, and they must have just snapped or something, you know.
Yeah. Yeah, it's the reason why it's so difficult to treat those is because every single bone is connected to the bone beside it by a ligament, both on the top and the bottom and from side to side. So if you broke one or several of the bones there, the assumption would have to be you also ripped the ligament off that was connecting them. So their recovery can take quite a while.
If I remember correctly, it was 2 or 3.
Yeah.
That was damaged, and oh boy, that was a terrible time. I remember it so bad. Chuck, you had a question. I thought you did.
No, not right now.
Well, you know, talking about frostbite and people that are in high risk, and once again, I mentioned the diabetics. One of the things that's sort of unique about diabetics is peripheral neuropathy. Of course, they're not the only people that can get peripheral neuropathy, just the most common group of people. But with peripheral neuropathy, the very ends of your nerves in your toes and in your hands, for lack of a better word, kind of aren't functioning correctly. I often say die off, but they're not truly dead. They're just not functioning correctly. And initially, people might complain of numbness, tingling, burning. Eventually, that might lead to constant pain. Because of neuropathy, that's why I put diabetics in an increased risk for lots of things, you know, injuries, infections, things like that. Because of not being able to feel the area well, if they're not examining it with their eyes, you know, they could let an infection, you know, brew for a while before they knew it was there. But being in the snow, they're already feeling the numbness, so they may not know the difference. So you really want to use common sense, keeping yourself warm, especially diabetics.
But you can get neuropathy without being a diabetic.
Yes.
So that's something. So if I remember correctly, somebody in our family had that, or was being checked for it. And I don't know whether it came back that she did or didn't, but it was something to do with the numbness or something in the toes, you know.
One generic word we use for it is idiopathic, which means we don't know why you have it.
Oh, really?
But, you know, before we say that you have that, there's a battery of tests by a neurologist that can be performed, skin biopsies, a test called an EMG that checks the nerves to see whether they're functioning correctly and at the right timing. Some people have numbness in their legs and their feet from back injuries, or sciatica is the common word that we use it, and that's usually, we notice it more on the side or in the thigh, but it obviously can extend all the way to the feet.
We both have that.
Do you?
Oh yeah. There was one day when I had to leave because I couldn't sit, and he had to do the whole show by himself. But I was going to ask you too, Doc. You know, you're based in Ashtabula, right? Is that where your office is?
Yes, I'm on the 4th floor of the Ashtabula Clinic.
Of the Ashtabula Clinic. And what are your hours? And
I have varied hours because I spend like Monday mornings a half a day in the nursing home, so I have later hours that day to accommodate for people. Tuesdays I'm in the wound care center, so I only have afternoon hours. I'm there all day Wednesday and Thursday, and then a half a day on Friday because I do surgery in the morning.
And that was another question I was going to ask you. So you are a surgeon as well?
Yes.
Okay. Okay. Where'd you go to school?
My undergrad was Notre Dame College in Cleveland, and there was a school in Cleveland just across the street from the Cleveland Clinic called the Ohio College of Podiatric Medicine. It has since moved to Independence, to a much nicer building too.
Yeah.
But
Yeah. So then, did you grow up around here?
Yes.
You did.
Yes.
So you're from Ashtabula.
From Ashtabula.
Oh, okay. Well,
I've always lived here. I even drove back and forth to school.
Is that
and,
right?
To residency and whatnot the whole time.
And it's great that you came back to your hometown to do your work, and that's wonderful. And can I add who your husband is?
Oh, sure.
It's Dr. James Chilcott, who will be coming on the show after the first year, I think you mentioned.
Right.
I haven't seen him for a while. He brought in, he had a great segment when he came in because he was showing the different kind of medicine things that you get out of the medicine cabinet.
Yeah.
And he explained all that stuff and what this would do and what that would do. He had a really interesting segment there.
Yeah.
So I'm looking forward to seeing him.
Vitamins are important. I can't honestly say I take any of them, but I'm sure at some point I will. But yeah, when I watch him take his medicine in the morning, it's like a little cup full of all different kinds of vitamins, everything you can think of.
Yeah, yeah. Did what was I going to ask you now? I lost my train of thought here. Is there any kind of vitamins or anything that you should take for your feet health?
I don't know of any specifically. There are some, and they call it more of a nutrient supplement, and that's more geared towards neuropathy. It hasn't really really taken full effect yet.
Sure.
I mean, it's supposedly proven to be helpful, but it's not covered because it's considered a food supplement covered by insurance. So.
Sure. Well, I tell you, you always do put on a nice segment for us here from ACMC, and I appreciate you coming in. Was it pretty bad driving in this morning?
Actually, I was expecting really bad, so when it wasn't so bad, it was a nice, easy drive.
Good. We'll have a safe trip home or back to your office.
Thank you.
And thank you for stopping by, Michelle. I really appreciate you coming in.
Thanks for having me.
Thank you.